Before we begin, I wanted to take a moment to introduce myself and the work behind SistahCare Alliance. My name is Teisha LèShea, and I'm the founder of SistahCare Alliance, which is a community-centered initiative focused on creating spaces for Black women and families so we can connect, we can access support, we can share experiences, and build pathways to better health. um, my work sits at the intersection of like community engagement and storytelling. Before I even thought about being a founder, I was a writer, a part time. So most of my stories have been from first person point of view. And then as I started to document my own health with chronic pain, it kind of revealed how storytelling is important when it comes to advocating for ourselves and building uh, the necessary community to thrive and get resources and be educated. Um, SistahCare Alliance's goal is to create and recognize a gap. Black women are often expected to navigate complex experiences alone, um, which may include pregnancy, postpartum, grief, loss, mental health challenges, caregiving responsibilities, or simply the realities of our everyday lives that no one either doesn't want to see or they ignore. So, through SistahCare Alliance, my goal is not only to raise awareness, but to help create connection, build community, and support pathways toward healing overall. Um, I think it's important that we discuss the elephant in the room. I've been to a lot of presentations so far, and the running theme is that there's racism and medical biases. Uh, it's been documented several times that Black women do not feel safe in these spaces. And I always refer it to the white person in a white coat. There is there is a psychological, um, I feel like trauma that's happening where we often get intimidated in those spaces, um, and refuse not to want to speak up and share our experiences. Um, so, as someone who has dealt with chronic pain, and for many years, I've been accused of being an addict and a drug dealer, even though that's nowhere in my record. And having been told to take Tylenol, we are just not sharing information. We are creating connection. And sometimes we have to have those hard conversations to do so. The inspiration behind SistahCare Alliance is indeed my mother, just to kind of see how she was dealing with her own health history and being ignored and constantly repeating herself while she's in agony and pain. Um, didn't sit right with me, and it will never will sit right with me. You kind of feel helpless when you can't help people that you love. So in 2024, it was actually a month before I realized I was going to get laid off. Is I went to my mom with an idea, and I talked about SistahCare Alliance and the reason why I wanted to do this advocacy work and community engagement. And the two words that she really said to me was "do it." So those two words kind of jump started my, I guess, career pivot into advocating and sharing information and inviting a lot of other healthcare professionals on to speak about what they know. Um, so I said I do this in her honor while she's still here, and I hope I make her proud by using her story as the push to help other women that I may never meet. Um, Black women are often expected to carry a lot. We carry pain, we carry responsibility, we carry sometimes moods for other people. And when it comes to our own issues like pregnancy, postpartum, infertility, and anxiety, uh, the room gets silent. The reciprocity when it comes to Black women is almost non existent. And I don't know if you are pissed off yet, but I think we're at a point where we should be, and we should start speaking or calling a thing a thing. Um, we've been silenced long enough, and I feel like Black women as a whole is in a crisis, with one being able to earn a living. We're not being hired. We've been getting fired. So it's starting to create a snowball effect that I feel like is going to erase the hard work that we've done. But with the work that I do, I want to be the person to always remind you of your importance to the world, to your community, to your family. Um, I think history has shown we've been through too much to stay quiet. And again, this is another instance where if we don't want to be seen, we can see each other. If we can't be heard, we can hear each other. And so I think that momentum kind of builds um, a, a, a wall to not only break through, but crash and burn at this point. I mean, we and women on this in this presentation kind of have shown how the ways that they're showing up, and we constantly must support each other in getting each other's messages across when it comes to being heard and being seen, being appreciated. Um, so that's why it matters to me. I've kind of my platform is currently on a newsletter basis, but I wanted to um, be simple as possible as far as navigation. Um, and these are kind of like the three pillars that I kind of like to focus on the most. I like to get healthcare professionals involved. I'm not the smartest person in the room. I don't have all the answers. So my job is to always seek the people who can um, apply knowledge, give advice, or simply educate. So I am considered that bridge for people. So with these three sections of the newsletter, there's a lot of interviewing, a lot of storytelling, and a lot of um, kind of training our mindset a bit on what to look for, what questions to ask. Um, the people that I've interviewed so far have kind of talked about how autonomy is so important. We must understand our own bodies in order for us to tell somebody what's wrong with it. And a lot of that is certain terminology. Um, there, the stomach is different from the abdomen. So if your abdomen is hurting and you say your stomach is hurting, that's you're not going to get the proper care for your abdomen. So I think little things like that helps us advocate for ourselves better. So that's where I come in. Um, I don't want to bombard people with jargon. I think I have a good job of translating what something means to other people. Um, so I've had success with that so far, and it's been enlightening to see people come back and say that the sessions and what I post has helped them. One of the sections that I really enjoy is the Sister Circle one, which is dedicated to Black women. If you're always wanted to share your story, that section is dedicated to you. It's a space to talk about the racism, your experience with the doctor's visits, your treatment itself, misdiagnosis, infertility, and mental health. So if you've never had a chance to speak your mind about your experience, that space is for that to do so. Um, I want to create SistahCare Alliance as not a one topic um, hub, but a many topic hub. I feel like Black women, we have many issues, and I wouldn't feel right if I did not do my best to serve those in need. So I enjoy partnering with other healthcare professionals, researchers, birth workers, especially birth workers, scientists, students, anyone who is passionate about the work that I'm doing. I would love to introduce you all to my community because the more you know, the better off I feel like you'll be. Um, Many of us don't see our faces in the exam room. So I wanted to kind of pump the brakes on that and say, well, there are people out there. It's unfortunate that you have to go high and low to find them, but I'm here to introduce these people to you as an option. So that's what that's like the main priority for me. It's not just to have information, but have resourceful information that can always be passed down to someone else who may need it. SistahCare Alliance is a network that constantly introduces the community to other women doing the work, which is all of you. And we want to align with those women at all times. Access to meaningful resources. As a founder, I can't go into the space with ego or pride. Before I'm a founder, I'm a patient. So my goal is always to seek the experts. We always have an expert writing piece for our newsletter or creating online events that connect patients to experts. We want to remove shame and embarrassment and allow you to show up and be you. The spiritual freedom um, we feel when we finally step out and reveal our stories is what my goal is um, just in life. I feel like the pain we carry becomes shackles, and we can't be our best selves if we're constantly boggled down by pain, shame, and embarrassment. So I want to tell you or affirm that your story is valuable. And if you are looking for the ultimate freedom of yourself and of the issues that you may carry, telling your story is where you should start most of the time. And I think for me, that's how I started. As someone who was diagnosed with scoliosis and had surgery at 12, and in my 20s being ignored because I felt something wasn't right, to now fast forwarded, I'm finally, after all these years, seeing a pain management doctor, finally being believed. It's I have to start with my own story, and it's been one that I can tell many times over because it becomes inspirational for other women to tell their stories too. So, but also we Black women have fight, we have grit, we have intelligence, we are smart, we are powerful people. Um, the world don't spin unless we're in it, and I think that should always be translated to our overall wellness and health. Um, our greatest weapon, I feel like, is our mouths. When we speak and bring call to action to things, the world kind of stays quiet. So I think it's about us finding our own power within and not gatekeeping that and sharing it with the world. And um, because nobody is going to speak for us. I mean, we've kind of hinted and winked and nodded, but nobody's going to speak for us. And the best person to tell your story is you. And while you're here living and breathing, it's probably the best time to tell your story and not have someone else read it in an obituary. So that's where, for me, where the true power comes from. Um, Black women are often expected to carry a lot in silence. You know, while maternal health, mental health is a critical part of this conversation, it does not exist in isolation. It is deeply connected to how Black women experience care, visibility, and support across their entire lives. It's time to burn the cape. It's time to not allow the systems that predict how you live a healthy life be the factor on how you live a healthy life. I always want to reiterate that without speaking the language of the community, the information will never translate. You have to meet your audience where they are and not where you want them to be. Um, One of the examples that I like to say is, for instance, if you are a stock investor and your job is to explain stocks in a room full of 5 year olds, how would you do that? You have to speak another language or use terms that they would understand. I've had my fair share of interacting with children, and over the years, I've gained a lot of experience how I can explain the same topic 50 million ways so the listener can understand it. And I think that's what SistahCare Alliance is pivotal when it comes to care and resources for all of us. For decades, there's been a gap when it comes to health information and research, um, which many of the times Black women don't benefit from. People tune out when the language doesn't reflect the audience. It's a challenge, and so um, I like to challenge people. You can't advocate for yourself if you don't have an understanding of the language, rules, and regulations. And I feel like that's the most basic, but that's the most important to grasp when it comes to uh, giving out valuable information, especially resources to people who aren't aware of the work that we do behind the scenes. Um, let's see. Um, Organizations often struggle with trust, engagement, and authentic relationships. What are Black women telling us they need? And it's simple. I think many of us have said it today. Is to be heard and not gaslit. The systems creating the barrier is white supremacy and racism. Again, we must call a thing a thing. How do we create support that reflects real life experiences? It starts with self. Learning to advocate for yourself and confident no matter what stage of wellness journey, good or bad, to understand that it's your right, it's your right, it's your right as a human to get care and most importantly, provide space for you to heal, regroup, and cry. As we all know, the system isn't set up for you to win, but to accept it. We can't sit around and wait for a law or legislation to pass, or maybe vote on a ballot that that is may take years and decades to pass when it comes to our health and well-being. Um, I don't have that type of patience. The longer we wait for a law to pass, more women are on the table clinging to their lives to give birth, and that's not one I'm willing to settle with. Um, as we all know, the mortality rate for Black women was high in 2023, and it's going to continue to raise. It's going to continue to get higher. I feel like um, that's why I always believe we have to use what we have to get what we want. And most of us doing these presentations have knowledge of something. And the best thing we can do is constantly feed the people what we know. Um, Conversations surrounding health and wellness shouldn't start during a crisis. It takes 66 days for a new behavior to become automatic. We do, when it comes to fitness or eating clean, we all know that those things take time. And I think that also can be translated to understanding the language when it comes to the healthcare system in general. And it's nothing to be ashamed about because the system was meant for us to not know what the system is. But thank God for all of us. Um, we are stepping out on faith and breaking those chains to say no more. So I am honored to be surrounded by smart and beautiful women who are also taking the necessary steps to leave a footprint in this world. So thank you all for that. Um, with many Black people and Black women in particular struggling to get health care or buried in hospital bills, the best thing is to ignore it in most cases. Asking for help reflects weakness. Support looks like I ain't got it. You need to normalize those conversations about mental health and understanding your health insurance. Ask questions. Normalize by talking about it. Um, Expanding how we define Black maternal mental health. Um, and that's why I kind of wanted to introduce something that I would love to start with many of you, if you would allow me. Um, we all have a good job of doing something. And over these past few months, I realized that I'm good at community engagement and saying topics that get the people talking. And so this service is for professionals like yourself who may not, um, who first of all hate social media, don't know where a post, don't know how to send, share, repost, edit. My job is to help you navigate your business to the best of its ability by, again, being that bridge for you. Um, I'm not gatekeeping this. I feel like I've had tons of practice doing my own with SistahCare Alliance. And so that is another skill that I would love to share with all of you if you're open to it. Um, just three simple categories and stages: community engagement, wellness engagement, and community program development. I'm pretty sure if you look back on your own personal business, uh, we all need these three things. And unfortunately, if you're the only one running the show with your business and don't have help, these three things can kind of get lost in the shuffle when it comes to your business. But I feel like these three things are the most important. Um, and I think this is an important time to reclaim our rhythm. I think, you know, I think we all know that Black women are the most exotic human beings to ever walk the earth. And the world don't shake unless we shake. And I think it's important that we constantly breathe life into one another when it comes to that. We have to understand our power and our positions when it comes to um, doing public service work. Because at the end of the day, this is what we're all doing. We are being servants of the people. And I think it's like what many of you have stated in previous presentations is getting back to community. It's listening and not listening to respond. It's constantly creating relationships and forwarding that information to those who need it. We are currently in a crisis, like I've mentioned before, and I'm challenging all of us to have all hands on deck. That doesn't mean you run yourself to the ground. We have to be smarter, but it means to just first be kind to yourself and to take a break. or lend a hand to those you care about. It's about volunteering to attend appointments with your friends or family as emotional support and to ask the questions the patient cannot ask. It's encouraging a loved one to maybe report a medical professional or to leave a review, um, or to get a better understanding of their own health insurance. I mean, those little things play a huge part in how we learn to advocate for ourselves better. So, with that being said, I want to thank all of you who joined. Um, I hope we all can remain connected. Again, Sister Caroline's is always a resource for you all to share stories, to give business ventures, to introduce new things. If you got a book that needs to come out, we are here for that. Um, I just I want to be a first option for people and not a last option for people. So again, thank you all so much. Um, just thank you, and I will be responding to the comments. I appreciate this space, so thank you so much.